Good afternoon. My name is Dr. Nka. Today, I want us to talk about an unprovoked animal bite. I'm thinking of a dog, a cat, a bat, a raccoon, a skunk. You know, all those animals. An unprovoked animal bite. You know, when you say unprovoked, you mean to say there must be something wrong with this animal. It can't just jump on you. There must be something wrong. What we have in mind is a rabies virus infection. You know, if you are in a hospital set up in South Africa, you work in OPD, outpatients department, you get these patients coming in. I've been bitten by a dog. I've been bitten by a dog. Oh, yesterday, today, you know, that kind of thing. And these dogs, you don't know whether these dogs are rabid dogs or not. When you say rabid, you mean to say infected by the rabies virus. Rabies virus is one of those RNA viruses, you know, ribonucleic acid viruses. Remember, viruses, it's either DNA, deoxyribonucleic acid, or RNA. RNA, it belongs to a group of viruses which actually kills us. Men. Think of 1918 influenza. It wiped out half of the world, or even more than that. So that was an RNA virus. Think of COVID, coronavirus. It wiped out quite a substantial amount of, the population. Quite a substantial amount of people in the population. That was an RNA virus. So this is an RNA virus. And I can tell you, untreated, this virus, rabies virus, untreated, it kills people. Actually, if you're bitten by a rabid dog, a dog that is infected with a rabies virus, and then you are untreated, you are bound to die. No two ways about it. Because this virus, even if it's a scratch or a wound, the rabies virus targets the striated muscle and replicates there, makes copies of itself, and you must remember that striated muscle is actually attached to a nerve, and the nerve goes straight to the CNS, to central nervous system. Central nervous system. When you say central nervous system, you mean the spinal cord and the brain. When it gets to the brain, it multiplies. It replicates rapidly. And once it gets there, then you can almost say it's the end of life. Because really, it mustn't get there. It is preventable. You send the patient to hospital, and the patient will be given, first of all, the wound has got to be treated. Has got to be cleaned. Has got to be cleaned with water, preferably warm water with soap. Make sure that you drain, you remove everything that you can remove, be it a virus, be it a bacterium, you remove it, remove it, remove it. That's the main thing. If it's a wound, even if you say, hey, I'm gonna close this wound, but please leave it open for drainage. You can't lock up the virus inside and lock up the bacterium inside. You've got to make sure that there's drainage, because when you are draining, you've got to stop the bleeding, to make sure that, you don't want anything to get to the striated muscle. You don't want anything, because that's where there's multiplication of replication of the rabies virus. Men, you don't want to see any symptoms, because when we see symptoms of this infection, it's the end. It means already, once you see symptoms, it means it's already in the CNS, in the central nervous system. You don't want it to get there at all. It is already multiplying in the brain, and then you start seeing symptoms. You don't want to see symptoms. What we normally do, first of all, you've got to establish whether the dog is vaccinated or not, because vaccination of dogs is done. That's what vaccination of dogs. Well, yeah, they are immunized to make sure that you've got antibodies for the virus. That, in other words, that can fight the virus, because the whole aim of immunization is to make sure that there are antibodies against this virus. How do we know that the patient now has symptoms? What sort of symptoms are we looking at? Oh, this is very discouraging actually, because you don't want to see these. You don't want to see a fever of about 39 degrees C. You don't want to see that fever. You don't want to see a patient who has what is known as lacrimation. Lacrimation, you just see tears. You don't want to see those. You don't want to see those, because you know that already treatment has been delayed. Treatment has been delayed. It's always a good idea to have a tetanus diphtheria toxoid given. It's always a good idea, well, to make sure that that there's immunization. Immunization is divided into two. There's passive immunization, and there's immunization for active. Immunization for passive, they call it Rabies immunoglobulin. Immune globulin. RIG immunoglobulin. That's for passive. But for active, you use something called the human diploid cell vaccination. That one is for active. If you've done that for active, then you don't have to do the RIG, the one for passive immunity. You don't have to do it at all, because this one is the most powerful. But when you send the patient, to to OPD and the patient is seen in hospital after a dog bite. Remember, we don't know whether the dog has been vaccinated or not. Most of our dogs, they are not vaccinated at all. So that is why it is important to give this vaccination to our patients. You don't want to see the symptoms, because when you see symptoms, it's already late. You don't want you know, you have to call the healthcare workers or the officials of the area to come and inspect this dog. This dog, first of all, it's a dog that you must identify. You must say, this is this dog that attacked me. Because that dog, a suspected dog, has got to be taken in. And we call a veterinary, a vet surgeon. A vet surgeon is going to come here and inspect this dog. And what inspection is normally something that is counteracted by the owners of these dogs, because the dog has got to be killed. And then so that an examination of the brain of this dog can be done, because there's no way that a dog can just attack people without, there's something wrong with the dog. There's something wrong with the brain of the dog. And what we think is that there's a multiplication of this RNA virus or this rabies virus in the brain. And when that happens, we get bodies in the known as negri bodies in the brain of this animal. Then if you get negri bodies, then you are making a clear diagnosis. You are saying, yes, there is rabies virus infection. Because negri bodies is a product of multiplication of these viruses in the brain. And again, if you get fluorescent, the fluorescent rabies antibodies, that's what you use to diagnose. The fluorescent rabies antibodies, that's what you use to diagnose and say that, yes, there's an infection by the rabies. Even before you actually kill the animal, those you can get from blood. Take the blood of the animal, take it to the lab. If they find these fluorescent rabies antibodies, then you make the diagnosis. That normally consoles the owners of the dogs. What I mean, that was because this is done before the dog is actually killed. When it is killed because you want to establish the presence of negri bodies, which are in the brain of the dog. And of course, you will have killed it to be able to do that and analyze that. So what is important is to be able to be safe ourselves as healthcare workers. Let's make sure that we don't get, domesticated cats, right? But we don't know if you are bitten by that. And the people who are at risk, unfortunately, are children. Children are at risk because they play with these cats, they play with the dogs and all that. And nobody will report. A child will just cry and you won't know. and you won't know that it's been bitten by a dog or it's been scratched by a dog. That is actually rabies. And because of their size, again, adults normally they are bitten by these dogs in the lower extremities, normally. So at least intervention is very good. I mean, between the striated muscle and the brain. But with children, because of their size, the scratch on the face is a risk factor. The scratch on the head, or the bite on the head, or the wound on the head is a risk factor, because now that's near the brain. So intervention becomes late most of the time. So when we see, the symptoms, as I said, the symptoms, it's a little bit late when we see the symptoms. You see a corneal and absent corneal reflex. Corneal reflex, the cornea of the eye. That reflex is responsible for the blinking of the eye. And then when you find that it is absent, then it means there's a dysfunctionality of the cranial nerves. Remember the optic nerve. Remember the facial nerve. Those are cranial nerves. And those nerves are supposed to work efficiently to make sure that there's a corneal reflex, so that the eye can be able to blink as a protective measure. And if now there's no corneal reflex, and that's what we look for when we want to establish whether the patient is dying or not. Once that corneal reflex goes away, you already suspect there's a problem here. The patient is dying or something. You don't want that. You don't want to see the symptoms of rabies. You don't want to see them because they're so bad. I mean, it just says to you, you are late. Photophobia. These patients, you have to, when you examine them, you have to examine them in a dark place, because because of photophobia, they just don't like light. They just don't like light. These like I say, there's something called flaccid paralysis. Flaccid paralysis. And you know that the patient is going. I mean, if you have flaccid paralysis, the next thing, what do you get? You get a coma. And then from a coma, the patient is gone. So these are, you don't want to see these. Once you start seeing lacrimation, the patient just, the tears just pouring out, lacrimation. Once you see those, you are worried. You're worried. They don't know. Here, you must now start counseling the family, because your intervention as a healthcare worker, of course, you can try to prolong, the life of the patient by giving the vaccination, as but it's a bit late, because it's already in the brain. When you get those flaccid paralysis, you get the photophobia, you get these patients earlier on, they even get hydrophobia. They don't want anything. They even thinking of water. It's a problem for them. They start having those muscles of the dehydration. Get lacrimation being excessive, you get salivation being excessive, just because of the thinking about water. They've got such hydrophobia that even thinking about water is enough to make sure that they get rid of the water that is in their bodies. In other words, there's excessive salivation. You know, the saliva just oozing out and all that. And from that, they get, you know, lacrimation as well. They get dehydrated. They get dehydrated from that. Once you see those, you are worried. And because it means you are, for whatever you had to do, you should have done it earlier on, or the patient should have reported earlier. Well, not should have been brought to hospital earlier on for intervention. So this, I want everybody to sort of, this is something that is preventable. It is preventable. Like I say, if the patient comes to hospital immediately post-exposure to a dog bite, the patient has to come to hospital. And if that happens, it's going to be given vaccination, and it's going to make sure, in other words, we're going to interrupt the infection moving from a striated muscle going through the nerve, going to the central nervous system. We want to make sure that that is stopped. That is stopped. Because really, if it is not done, and you've got to understand that was this bite unprovoked? An unprovoked animal bite is telling you that there's something wrong with the animal. And what tells you that there's something wrong is the fact that unprovoked. Because normally animals, they attack you when they are provoked. But now, if the animal attacks you unprovoked, then it means there's something wrong. The animal is unwell. In other words, what you're thinking, there's a multiplication of viruses. In other words, there's rabies virus in the brain, and that's a little bit late. That's a rabid, we call that a rabid dog or a rabid animal. It can be a cat, it can be a raccoon, it can be a skunk, it can be anything. It can be, as long as it is an animal that this is infected by a rabies virus, this RNA virus. These RNA viruses are terrible. You know, even Ebola virus is RNA. Even, COVID, coronavirus, and they are killers. So here's one which attacks the central nervous system. This is something not to be forgotten at all. You don't want it to go to the central nervous system. You'd rather intercept it when it's still at the striated muscle level. Thank you very much. I appreciate you all listening to me. I hope you're going to take this seriously and say, the rabid dog is not going to be, a rabid dog is not supposed to be there, to be honest. It's not supposed to be there, really, because it's a potential danger. It's a risk factor. It's a potential danger to whoever is around it, especially the pediatric community. Especially because thank you very much. Thank you very much. I will come back with another infectious disease, because I tend to concentrate on these infectious diseases. Thank you very much.